IVF stands for in-vitro fertilization. And in medicine or in science, whenever we say in vitro, it actually means that it's happening inside the laboratory. I break IVF into several different parts. So basically part one is making the most of the eggs that a woman provides every month. What we do is we stimulate the ovaries using the same type of hormone that your brain produces. And in order to fuel their development. And we monitor and watch as your follicles develop, and hopefully the egg inside the follicles are maturing. And when we see that the timing is appropriate, the follicles have reached a size that we believe there should be mature eggs inside, we trigger ovulation and then do an egg retrieval. And with the egg retrieval, it is a very minimally invasive procedure done with ultrasound guidance. And basically we aspirate each of the follicles using a needle. Basically that then is tapped into basically through tubing into a test tube that gets passed off to the embryologist, who will check to see whether or not there's a mature egg inside. Basically, that's part two. It's done under anesthesia. And once we have the eggs, then it's kind of the culturing of the embryo begins. And that's really the in vitro part. So what we've done in the laboratory is simulate an environment that's similar to your body, and allow the embryos the kind of the best environment to develop in. We want to mimic everything as close to nature as possible. And then the last part of IVF is really then transferring the embryos back into the body. And so with that, with frozen embryos, we do have to prepare the uterine environment, again, to mimic the right time in the menstrual cycle when the uterus will be open for implantation and the uterus will be in a receptive state. So we help mimic that through giving patients, estrogen, progesterone. Everything is timed very specifically, and then we perform the embryo transfer, and that's actually a very quick procedure as well. Don't need anesthesia. For the egg retrieval, we do use anesthesia. But for the embryo transfer, it takes about 5 minutes. We use a small catheter inserted into the uterus under ultrasound guidance, and then release the embryo gently into that warm, safe space, hopefully, that we've created. And then we have to wait to see over about 10 to 12 days is usually the next time that we're going to check to see if implantation happened by checking an HCG level.
Regardless of your situation, our nationally recognized infertility specialists will work with you to develop a personalized fertility treatment plan. Give us a call. We create miracles every day.